Hello, everyone. It's Dr. Tamar Beckford with Your Caring Docs. That's right, where we're helping our busy professional women keep themselves going, making themselves know that you are important. Self-care is important. Yes. Now, I have this wonderful podcast. This is my Docs Who Cares. And I'm super excited about this podcast, right? Because I share all of my docs from all over the world with you, and you get to find out about all the interesting things that they're doing. Best things that they leave their info. If you'd like to connect with them, you'll know how to do so. So now today I'm bringing in I'm going to call her the bad mama jamma, and you will find out why, because she is that awesome. Now I'm gonna bring her in our Your Caring Docs fashion. I'm gonna keep the cliffhanger going. You'll be like, who is this person that Dr. Beckford is talking about? Alrighty, here we go. So she's a graduate of New York Medical College in Valhalla, New York. New York, stand up. Boom, that's you, your girl. Yes. And she did her training in general surgery at New York Hospital in Cornell, NYC. Yes. But then, as most of my docs, they don't stop there. They said, like, you know what? I'm going to get more training so that I can help more people. So this wonderful lady doc, now you know, she did her cardiothoracic fellowship training. Cardiothoracic. So she's a CT surgeon, and she did that training at New York Langone Medical Center. And then, like I said, most of my docs, they don't stop there. She's like, you know what? I want to learn even more. So she did extra training down here in Texas. She went to the Texas Heart Institute and did some extra training at Baylor Medical College. Now, she is also that and all that in a bag of chips. And guess what? She's a breast cancer survivor. So let me tell you, not only is this doc one of the 5% of women who are CT surgeons in the country, but she's also a breast cancer survivor. Now you know why I tell you that this bad mama jamma is here to lay it all on you. Welcome, 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 Dr. Susan Trocciola.
Thank you very much.
We have to give her extra time for that. I mean, like, woo, doc, welcome.
Well, thank you. I'm happy to be here.
Oh my goodness, bad mama jamma, knocking it out in all areas of life. I love it. All righty, so Dr. Susan, tell us. Like, we're here and we're seeing this person who is like this bad mama jamma. And to me, you're kind of almost a little bit larger than life, but it all started somewhere. You know, it all started somewhere. So when did you decide, I want to be a doctor? I want to go into medicine?
I probably decided like when I was 4 or 5.
Woo, what?
I mean, I always loved sick people.
Mm-hmm.
If someone fell at the playground, I ran to them rather than away from them. So I decided when I was really young that I wanted to be a doctor. But I then didn't become a doctor right away.
Tell us.
Because my dad is a very traditional Italian. Mm-hmm. And, you know, Italians, you either can be a woman, you either can become a teacher or a nurse. And I didn't really want to become a nurse, so I became a teacher.
Wow. Okay. Now this journey is even way more interesting than I thought. So how long did you teach?
I taught for 4 years in New York City. I taught high school at a private school.
Nice.
And then it was really through my students that I ignited my desire to become a doctor, because I taught this research course, and it was the purpose of the research course was to get more girls interested in science. Mm-hmm. And being New York City private school, these kids did amazing projects, and they all were preparing for med school. So I was like, wait a minute, if I'm teaching the course and they're going to go to med school, I think I can go.
Right.
So then that's when I decided.
Oh, I love it. Yeah. Well, you know, like here on our Docs Who Care, we always have so much respect for all our teachers, because we know that without them, we wouldn't be where we are. So I love the fact that you started out as a teacher, even though your passion was to be a doctor. Yes. And then you got inspired by your students.
Yep.
You know, to say, you know what? I'm inspiring these young ladies to go in and go forward for your dreams. Go, you can do it. And then you look back at yourself and you're like, you know, that was my dream. I'm telling these young ladies to do that. Why don't I practice what I'm preaching? Boom. All right.
And the best part was when I was a resident, I ran into one of my students. She was a medical student, and I looked at her and I said, "You're the reason I became a doctor." And she said, "You're the reason I became a doctor." And that was really cool.
Oh my goodness. Chills.
Yeah. It was a great moment.
Absolutely. Wow. Oh my goodness. All right. So I love it. So now we're here and, you know, you're a doctor, but then you go into surgery and you're doing this and then you go into cardiothoracic surgery. Right. So you didn't even stop there. You're going into getting into medical school is challenging enough. I think there are only probably like 7% of the population who apply to get sent. And then you're in there and then you're now going towards a specialty that you are currently in a specialty, I should say, that only 5% of women are in that specialty. So what made you push to go towards cardiothoracic surgery?
Well, I never thought I'd be a surgeon. I mean, I always thought I would either be a pediatrician or a medical doctor. And then so I did in med school, I did surgery as my first rotation. Because you're supposed to do the rotation you don't want to do first.
Right.
And I loved it. Like, I loved the residents. I loved the surgeons. I loved the energy. And I just kept coming back to it. Like, I just kept, wanting to do it over and over again. And then the same thing happened. And then when I decided on surgery, I thought I'd be a surgical oncologist, a cancer doctor.
Right.
And then I did cardiac as my first rotation as an intern, and I loved it. And I think it was also a challenge because my first day, the fellow looked at me and said, "Oh, you're a chick. What, are you going into plastic surgery?" And I was like, "I don't know." And then one of the other fellows invited me because he saw that I loved cardiac. So when I finished the rotation, he said, "If you ever want to come scrub cases, you can." And the guy that had thought I was going to plastic surgery again said, "You're not going to come. Like, you like it now, but you'll never come." So I came like every Monday. I came for cases. And I just loved cardiac. I mean, I loved that patients got better. I mean, I thought surgical oncology was hard because you could think you had a healthy patient and you open them up and unfortunately they have metastatic disease. Well, most cardiac patients get better. I mean, they don't all, but most come in really, really sick and they go home better. And I really like that aspect of it.
Wonderful. I love it. You know what? Let's put it like this. You can't step up to a New York chick and say that you're not going to do this. Oh,
That's
really?
Right.
Oh,
That's
really?
Right. Yep, exactly. Exactly.
I love it. I love it. I love that, all the things and the myths that you had about what you thought you were not going to do.
That's right.
Like these are all the paths that are in you. You said, what, this is the hardest. I'm not going into surgery. I'm just going to get it out of the way because I know I need to do these. I think surgery was 8 weeks. I need to do these 8 weeks. So let me just get this 8 weeks done so I can move on to what I really want to do. Right. And then you get pulled in and you're like, ooh, this is so interesting.
Exactly.
I'm loving this. Wow. All right. So cardiothoracic surgery, you're doing this for many, many years and then boom, life changes. You get this diagnosis. So do you remember where you were?
Oh, yeah.
What
I remember it all. So I think it's important to know my aunt had breast cancer at a young age. And hers came back about 10 years later and I saw her die. And I was actually there when she died. So I didn't associate breast cancer with positive things. And I had something called lobular breast cancer. Most breast cancers are ductal, which form masses. Lobular is harder to detect. So I noticed some changes with my breast, but it felt more like a heaviness, like the changes you get with your period. So I was like, yeah, it's nothing. It's nothing. And then it's got more abnormal. And then my nipple inverted. Ooh. And as a doctor, that's cancer.
Absolutely.
But I was still scared. And, it still took me, I think, another 2 weeks. And what's interesting, we as doctors will look at patients that come in with a breast mass and be like, how do they not do anything? It was fear. I mean, I really, on some level, thought breast cancer, death. Yeah. So I was, it wasn't a conscious decision, but I was fearful.
Absolutely.
So I was working in Florida. I was traveling doctor, and I was like, how am I going to get this done? So I had a free day, and I went and got a mammogram. And I remember the tech was all excited it was awful because she called the other tech in. Oh my God, this is cancer. Look, see this mass? This is cancer. And oh, look, it's probably cancer in the other breast. Like, she was excited, and I'm here by myself, scared to death. It was awful. So I'm in Florida by myself, no family, no boyfriend. And one of the residents ahead of me worked at Mass General. So I called her from the mail and I said, Michelle, it looks like I have breast cancer. Can I come and see you? When do you have office hours? And she said, anytime you get here. Mm-hmm. So I quit my job. I called the recruiter and I said, I need time off. Mm-hmm. I walked out that night and I got on a flight and I went to Boston, and 2 of my sisters met me and my best friend. Mm-hmm. And then I remember, like, I tried to have a brave face with my sisters, but then when Michelle, looked at my breasts, it was very abnormal at this point. Mm-hmm. I could just see the look on her face. She was just like, fear, no, like, this is bad. This is a big, like, I had a very large tumor. And she was like, oh. And so I whispered to her and I said, what do you think the chance that it's stage 4? I said, like 50%. And she said, no, higher.
Oh my gosh.
And that moment, like, changed my life forever.
Forever. Absolutely. Oh my gosh. I cannot imagine the fear. So there's one thing of a fear of an unknown. And then there's also that fear of known.
That's right.
And I think that the combination, being a doctor going through this, you have both fears at the same time. Mm-hmm. Because you see like you said, once the nipple inverted, we all know. We taught that, right there in your differential diagnosis, or even like during the first couple of years of medical school. So I cannot imagine how that fear was. And that fear was a paralyzing fear, because it paralyzed you for 2 weeks. You knew what was going on, but each night you go to sleep, it's probably what am I going to do? How do I go about this? Where do I go? How is this going to turn out? There are just so many questions. I
didn't know how to, like, I didn't know the mechanics of it. Mm-hmm. I think I called my mom's breast doctor because she was at high risk as her sister had breast cancer. Mm-hmm. And I said, can I get in to see the doctor? I think I have cancer. And they were like, if you're not a regular patient, no. So I was like,
that is, and I think that's one of the unfortunate parts of our health system. I mean, if you as a physician who is a colleague, rest assured, if you spoke to the physician themselves, maybe it would have been different. Right. But can you imagine those who are not directly affiliated with the healthcare system, what they're going through?
Oh, it's awful. Yeah, it's awful.
Oh my gosh. All right. So, your friend who sees you, and I'm pretty sure your friend is probably heartbroken too. But
I can tell she was heartbroken.
Yeah. Having to, because she wants to make sure that her best friend, her friend, someone that she knows that she went to school with is, that she gives her the best care and the best outcome. So what was the plan? So she biopsied me. I mean, I was fortunate. She biopsied me that day, because it was a big breast mass. So she was able to do it. And she got the pathology back that night. Or I think the next morning she got it back, which is very unusual. I mean, I was fortunate. And it was a slow growing tumor. So that gave us a little bit of relief. She was like, I remember her coming in and saying it's lobular and it's slow growing. The grade is, low grade. Mm-hmm. But and then I went through the metastatic workup, which was a CAT scan and a bone scan. Mm-hmm. And that was really scary, because I didn't know at that point, am I going to die? Yeah.
And then the other difficult thing that I had was I had insurance from a hospital I'd worked at in a small town in Pennsylvania, but I no longer work there or live there. And basically that insurance didn't cover anywhere else but their system. And I didn't want to go to their system.
No, because you have this trusted person here who has your best interest at heart, who's going to tell it like it is, or will go the extra mile to ensure that you are a survivor. You are where you are right now, that you're able to be here to tell that story.
Yeah, exactly. So luckily my sister, because I was pretty numb from the moment I got diagnosed till about a year later. I mean, a lot of physicians that get cancer get I was just kind of like, it was just too much for me. I I didn't look it up on the internet, but my sister was able to get me insurance in Connecticut, because that's where my parents lived, off the Obamacare.
Oh.
So I got that. And so I couldn't, actually, my friend couldn't treat me then. But what she did do was help me with a plan. She said, this slow growing tumor, normally, like I had stage 3 because of the size. Normally we would give chemo, but lobular doesn't respond to chemo. So I think you should just go right to surgery, and then we do chemo after. So then another friend from residency as well was at Yale, and that was near my parents. And he got me into an oncologist and breast surgeon. And I went to them and I said, this is my plan. And they were like, at first they were like, and then they were like, okay, that makes sense.
Yes. Wonderful, wonderful. Wow.
So the plan then was surgery, 4 months of chemo, and then a month of radiation.
Wow. So what was that recovery part like?
It was hard. I mean, I had a single mastectomy. Most people have bilateral, but you don't have any increased survival. And that's what my surgeon wanted to do. And then I had what's called a deep flap, which is where they take your fat from the belly and they move it up to your breast. It was a hard surgery. I mean, it was just hard. I mean, I as a surgeon put drains in patients all the time. Those drains hurt like heck. Wow. So, and I was pretty deconditioned when I went to surgery. I had gained quite a lot of weight. I was probably at my heaviest I've ever been. I hadn't been exercising. And there wasn't time to get in condition. So that was it was hard to recover from. But I was lucky in Connecticut. They had a program that if you were a cancer patient, you could get physical therapy. So I started physical therapy pretty early, which helped.
Wow. So physical therapy, you're noticing that it's helps in getting you to, and I love the fact that you're so honest by saying that, I was pretty deconditioned, because a lot of people, they're thinking they're entering into this phase and you're like physically fit, but the average person isn't physically fit. The average person is starting from a place where there's so much going on in life. They have all these external factors, these people that they're taking care of. They're trying to take care of themselves, but sometimes it's hard because so many of your responsibilities seem to be right there in front of you. You're trying to just get through the next day. So I don't have this extra time for myself. Right. And, so they're at a place where they're deconditioned. And like you're saying, that this is a hard surgery to go through, So
I was kind of that patient that doctors always, I hate to say it, look down on. Oh, how could somebody, have a fungating breast mass? Mine wasn't fungating, and not, what's wrong with them? And how could someone be, overweight? Well, you know what? As you said, it can happen to an intelligent person. Life gets in the way. You've got other things going on. You put your own health on the side and you take care of everyone else but yourself.
Absolutely.
And that's what I did.
Absolutely. Wow. So what would you say was the hardest part of that whole journey?
I think chemo. I had a really hard time with chemotherapy. I mean, it just made me very nauseous. So I had a lot of nausea with it. So I would be knocked out for 2 to 3 days after chemo. So I got chemo for 4 months. And it was just hard. It was really hard. I mean, that, and I had to move in with my parents and they're older, and my mom had Alzheimer's. So she couldn't remember what was wrong with me. So we had to keep telling her I had cancer.
That means that she's reliving that emotional state where she's finding out her daughter is.
And then my dad, he had a hard time with it. And I'm in my 40s, it wasn't like I was in my 20s. I always tell a story. So I lost all my hair and he couldn't see me with my bald. And one morning I heard my mom fell down the stairs. I heard her and I went running down and I screamed to my dad, "Dad, Mom fell down the stairs." And he comes running out and he goes, "Why aren't you wearing a hat?" To me, because I had no hair on.
Because you had no hair. Oh.
Yeah. So chemo was hard, but I got so much support. People came out of the woodwork, people that, because my sister created a webpage, a Facebook page for me, and I decided who I would allow in it. Right. Where she talked about my journey and, she had surgery and we're hoping there's no nodes and chemo. People sent me gifts that I hadn't seen in 10 years. People I had worked with in New York before medical school, people I had been a resident with. It was amazing how many people, sent me cards, sent me gifts.
That's the other thing that's giving me chills. I love the support that you got.
Yes, I did.
And I'm pretty sure that support kept you going.
It did. Yes, it did.
You know, so what would you say for those who are watching someone go through that, but then they're afraid? Because there's some people that are just like, well, I don't know, what should I say? What should I do? You know, they get paralyzed by the fear of saying or doing the wrong thing.
Right. I think there's that whole concept of holding space, which is just listen. The patient, you know, I didn't want to talk about support groups. Like I didn't do any support groups during my cancer journey. I did after, but during them, I didn't want to talk about my cancer. You know, people would ask me what stage I am. I don't want to talk about it, but you know, some people do. So if you have a friend with cancer, say, hey, what do you want to talk about? Do you want to talk about your cancer, or do you want me to tell you what's going on in my day?
I love it.
You know, and just like, as I said, for me, chemo was harder for me than some people. So having the mailman come with a package every day was huge. Just sent them anything. Like it didn't matter what they sent me, a mug, cookies. You know, someone sent me a ham. She was a cancer survivor, and her appetite changed, and she said that was the only thing she could eat was a ham. But you know, send your friend a card. It doesn't even have to say anything other than I'm thinking of you. You don't have to write a long thing, but just be there for them. Offer to go to chemo. I mean, chemo was hard, and sometimes offer to go to chemo and just sit there. That person may not want to talk. You know, at chemo, just be there.
You're the second person whom I've interviewed who is a survivor who said the same thing. You know, so that just having someone there just with them,
right?
It just meant so much. You know, it's to the point that she herself, rest assured, we're in the time now of COVID during this pandemic, you know, so it's harder. But, you know, when you do get back to the point where you can have visitors or so, they said just really just being there. And like you said, they might not even have to say anything. You can just watch your show together.
Yep, exactly. Just having someone there that you know, because chemo room is a scary room. I mean, you know, sometimes they have a private room, but usually you're surrounded by other cancer patients in all different stages of cancer. And it's hard to be a patient. It's hard to be a patient.
Oh, wow. I cannot like imagine the fear and the emotional roller coaster that goes through. Because some days you're like, I'm good. And then other days you're just fearful, like, is this my last day? You know, will I just suddenly have this change and, you know, just get worse?
Right. Yeah. I mean, that's all I could think about. Am I going to die in my 40s? I mean, and that's where I always say my life changed. Am I going to die in my 40s from cancer and look back on my life and say, why did I work so much?
Right. Okay. Well, there we go. So now that was you had my next question. I'm like, how have your life changed since then?
So, I mean, I think before cancer, I thought I was so important as a doctor. And I thought I was the only one that could do things. So if my patient was sick, I stayed late, even if I wasn't on call. If, you know, no one could work for the holiday, I worked the holiday, you know, because I don't know, I thought like it was my noble calling, and my patients are important. And there are nights that I still need to stay late, but there are other people that can do it. You know, there's a call schedule because you can take turns. Yes. So you can talk to your, you know, like your colleague and say, hey, look, I've got this sick patient. I did this surgery. Can you watch out for this? And that's not to say I never stay late. I still stay late, but life is short. Yeah. Like you're just not promised tomorrow. I mean, before cancer, I thought because all my relatives lived to their 80s and 90s, I thought I would live to my 80s and 90s. So I put off so much. I never got married. I never had children because I kept saying, gotta be the best doctor, gotta be the best doctor, gotta be the best doctor. I'll do that later. I'll do that later. I'll do that later. And then all at once you're sitting in a scanner, not sure if you have, you know, if you have stage 4 cancer, and you're like, I may never get to do any of that. So you know, so I went back to full-time work after, and I worked in Tulsa, which I loved. I really loved working there. But then I took a job in New York, and they didn't believe in giving me time out. Like, it wasn't a busy place. Tulsa was busy. I mean, and there were holidays. Like, I remember on New Year's Eve, I was planning to go out, and the guy on call was in the OR, and my friend, the cardiologist, called me and said, I got a guy trying to die on me because he's got a blockage. Can you bring him to the OR? And I said, of course I can. Called my friend, said, I'm not coming to the party. And I brought the guy to the OR. But then I had a job where it was just like, well, you have to stay to 5 just because you have to stay to 5, even if nothing's going on. I was like, I don't want to, like, I'll stay all night if something's going on, but I don't want to just stay here when I live half a mile away to make you feel better. You know, I just wanted more balance. So that's when I decided to do locums, which is I travel to different cities and I make my schedule. So like now I don't work Christmas. I don't work Thanksgiving. Yeah. Even the assignment I'm at, where I really wanted to come to this assignment in California, they said to me, okay, well, to take the assignment, you have to work Christmas or Thanksgiving. And I said, no. I said, if you want me to work one of the holidays, I'm not going to take the assignment. Mm-hmm. And they were like, oh, okay.
And now you're having, so I love that through this journey, you have figured out what is most important to you.
Right.
And you are acting on it.
Yes.
You know, it's a difference between when there are a lot of times we say like, yeah, you know, well, this is so important. And even I am listening and I'm learning so much. I'm in my 40s and, you know, life, when you're working towards different goals, it's so easy to put things on the back burner.
Yep.
But then I'm learning that you have to have some hard stops.
That's right.
In life.
That's right. Yep.
And if not, life will give you hard stops.
That's right.
And to really allow you to realize what truly is important in your life and to make those things a priority. And like we said, it's not that you're giving up everything else, you know, and I think that especially with us as doctors, we work so hard to get where we are. So we always think, well, we need to be there all the time, which is what, you know, well, I mean, I help people. The heart is like one of the most important organs. Right. Like, what do you mean I'm not going to sit here and make sure that their heart's functioning properly? But you have to remember, as you said, that you're not the only person, right. You know, and that's why they have turns. I love that. That's the biggest thing that I love that you said. And that's why they have turns. You know, we have calls so that we all do our part. And that's so right. We can all enjoy this thing called life while still taking care of our patients. It's so important.
And as I said, I mean, you call, you know, I have a doctor call and say, I have a patient, I'm worried about cancer. Can you see him? I'll see him that day. But at the same time, I took 12 weeks off this year.
Yeah, important.
And I took 12 weeks off and made more money than I made in a full-time job. And saved some lives, but, you know, but I still had time off and time to spend with my family and my friends and doing things I love.
Love it. You know, this takes us next to this next question about self-care. I love it. So I'm definitely, all right, let's put it like this. Those 12 weeks off is definitely self-care. That's self-care to the max.
Yes, it was.
I'm going to, you know what? I'm going to work to be like you because I need those 12 weeks of self-care.
It was hard. I mean, because I only get paid when I work. So it was hard to take that time off. But, you know, I mean, my coach said to me, what are you going to remember at the, you know, when you die? Are you going to remember that extra X number of dollars? Or are you going to remember that you had, you know, most of the summer off to spend with your nieces and nephews and your friends?
And experiences that you've gained so
That's right.
Experiences.
Yeah, it is all about experiences. Yep.
Absolutely. All righty. So other than the 12 weeks of vacation, spending time with your nieces and nephews and just really having a great time, what are some of the things that you do for self-care?
Well, I love to garden. So I love spending time outside, you know, and I just like creating things outside, creating a garden, planting flowers, nurturing flowers. So that's my big thing that I love to do.
Oh, I love it. I think you are my second doc who loves to garden, my third doc who loves flowers.
Yes.
I love flowers. I'm horrible at gardening and I accept it. Now, when I first came out of residency, I thought I was going to have this beautiful garden. Like I love watching all these English shows. They're always really beautiful gardening. And I just knew I was going to have, I have knockout roses because that's the only thing I can keep alive.
Well, I mean, if you can't keep it alive, then you buy something else.
Exactly.
I mean, I'm not a perfect gardener. There's plenty of things that I can't keep alive.
My mom's she's great. She has a beautiful green thumb. Me, I'm like, woo, there we go. Add some water to these knockout roses. Thank God.
Right. Yes.
So love it, love it, love it. Alrighty. So now I have my wonderful, wonderful questions that I ask all my awesome docs. Now, if you weren't a doctor or a teacher, because you already did that, boom, pull that one off of the thing. What would you be?
God, I don't know.
Well, we love flowers.
I think I'd be a full-time foster mother.
Oh, wow.
Yeah, because I didn't have children, and I'm hoping to foster, but it's a little hard with traveling.
Mm-hmm.
But I think like if money wasn't an object,
Mm-hmm.
well, even if money wasn't an object, I still love my job. But if cardiac didn't exist, I couldn't teach, and I had unlimited money, I would just open up my house to foster kids.
Love it. You're the first doctor that I've heard answer that question that way.
Yeah.
I love it. And I'm pretty sure that there's so many in foster care, those who are listening, you know, who are affiliated that'll probably try to see how they can help you to gain that. Because and it goes again towards your love for helping and helping others. You can see it, you teaching. Because I mean, you had teaching a nurse and you're like, I'm not going to be a nurse, but you see, you still went into
and there's nothing wrong with being a nurse.
But you went into teaching because of the care. You want to give back to the kids.
Yes, exactly.
Thought about being a pediatrician.
Yep.
And then, so yeah, your love, it's there. And like we said, there's nothing wrong with nursing. It's just really showing that you do have the heart for the kids. And I'm pretty sure that you definitely will be a great foster mom.
Yep.
Oh, I love it. All right. So now this is such a wonderful journey that you've taken us on. And, you know, people are listening to this and they're just like, wow, this is so fascinating. I want to have her on my show. I want to tell her story. How can I get in contact with her? Let them know how they can find you.
I think Instagram is the easiest way. I'm at Dr. Sue, Troc.
Okay.
And then they can just DM me through that.
And just let them know, let them know where you found her. Like, hey, I was listening to this Docs Who Care podcast. Yeah. I love your story. I want to tell it more. I really want to let others know about your journey. How does Bad Mama Jamma, 5%, cardiac thoracic surgeon woman, and she knocked out stage 3 cancer.
Yep.
And doing that, and also, your journey through the healthcare system. You have so many perspectives to really enlighten others on.
Yes.
Doctor, thank you so much.
Well, thank you so much for having me.
Oh man, yes, this is a wonderful, wonderful experience. You really, I'm still having chills. I mean, I'm so glad everyone can't see because all the hairs on my hands are standing up. It's such a journey. And I love you that you're so powerful and that you're so honest with all parts of the journey, the good, the bad, and the in-between. Thank you so much for stopping by.
Thank you so much for having me.
All right, for all of you guys who are listening, I know that you love this journey. So give her a 5-star review on our podcast and make sure you get in contact with her so that you can get more about her story and even follow her on Instagram. So it's Dr. Susan, is it dot? TRS?
It's Dr. Sue Troc.
Okay, so Dr. Sue Troc. So, alrighty. So all of you guys who are listening, thank you so much. I'm Dr. Tamar Beckford with Your Caring Docs and our Docs Who Care podcast. And now you understand why I was so excited because this is my Bad Mama Jamma. Woo! Yay, Dr. Susan Trocciola. I'll screw your name up again.
Trocciola, that's fine.
Trocciola. Ooh, I practice, y'all. I promise I did. Dr. Susan Trocciola, thank you so much for stopping by.
Thank you so much for having me.
Yes, my New York chick who's killing it out there. And she's available. She's taking care. See, the good thing about her too, before I leave, is that she's taking care of people all throughout the United States. So although she is born bred in New York, she is available. And so if you see her on your path, you just give her a high five and let her know, thank you so much for all that you do.
Thank you.
Love you guys. Take care. Bye-bye.